Reflecting upon the rise in number of cases and deaths in the nation, Dr. Purvi Parikh again urged all to practice social distancing while doctors nationwide take care of thousands of patients. Highlighting the peak of the virus, Dr. Parikh also expanded upon the ongoing treatments and research on COVID-19 while also giving her comments on the impact of this virus on children and also on the concerns of frontliners. Here is Dr. Purvi Parikh.
The numbers are staggering, and every day we're hearing about numbers going up, deaths going up, hospitalizations going up. The good news, however, is that majority of the cases are either recovered or recovering. So even though we keep hearing about these large numbers, luckily many are doing well, but that's not to take it lightly, because we are still seeing a lot of hospitalizations, a lot of people that are very, very ill, and we don't know who is going to be the one that's very sick versus not. So we all still have to take it seriously. But again, it's not a need to be anxious or panic. Right. So peak usually means that will be the highest point of cases, and hopefully after the peak, the amount of cases, deaths, hospitalizations, all of that we're hoping will come down, because right now it keeps going up. So we want it to either flatten out or even start decreasing, ideally. But, that is not a reason to, immediately think that next week everything will be back to normal and all of these restrictions will be lifted. That will still take some time, because the last thing that we want is to let our guard down and then we have another surge of cases. So we're hoping, at least for after the peak, that we start to see the cases decreasing, but it will take a lot of time before things are back to normal and a lot of the social distancing is lifted. Right. So, I think we're still quite a ways away from reopening. I think it will still be weeks. I'm hoping not months, but we have to be ready for that possibility too, at least weeks to months. And even reopening is not going to be a sudden reopening that we're all going to go back to normal. It's going to have to be very slow and gradual, because we've seen in other parts of the world, if you let your guard down too quickly, you can see a surge of cases again. And that's the last thing that we would want. So we have to do it very carefully and cautiously and slowly, so that, we don't have an increase in the cases again. Yeah, it's been a little bit sad and disheartening for the medical community, because many of the physicians that are getting sick, and even one passed away early this morning. It was actually a New Jersey physician, Dr. Priya Khanna. She was very well respected throughout her community. It's very sad for us to hear, because these are not just our colleagues, but also our friends and our family members and the entire physician community, not just South Asians. The entire physician community is affected by this, because it hits very close to home, and it even underscores the need for us to continue social distancing, because these are people's lives, and every physician that's lost, that's thousands of patients that they could have treated and they could have helped, so it's not just impacting that one physician or their families. It has a global health impact, because if we lose all of our doctors and our nurses and healthcare workers, then there won't be anyone left to take care of all these patients. So it is quite distressing, and quite a few South Asian physicians have fallen ill, and sadly we are hearing about deaths as well. Right. So, there's many centers that are already doing vaccine trials. Even here in New York City, I know that, NYU is going to be starting trials soon for both the NIH, an NIH vaccine trial, as well as one with the industry itself. And so we're hoping that results from these trials will be promising, because I think the vaccine will be the biggest, the biggest piece of equipment or weapon that we'll have against this virus, of getting things back to normal. But the problem is vaccine trials take a long time, because one, we need to see if the vaccine works, and that can take weeks to months to mount immunity. And then on top of that, we need to make sure it's safe, right? If we're injecting people with something. So it's not an overnight fix, but luckily many pharmaceutical companies, as well as our own government agencies like the NIH, are working on trials, and there's already patients that have been receiving the vaccine in a experimental study based way. So I'm hoping that we'll get more positive results from that soon. Some of the other medications too, this again, until we have good studies or data, we won't know what really works the best. So that's why we do these trials. They take time, but they're worth it in the long run, because that way we'll know what antiviral is best, what combination of medicine is best, and what's safest for the patient. So, most commonly, fever is one of the most common symptoms, even in children, and it's usually a high fever. So that means over 100.4. Usually under 100, we're not concerned, and most healthcare professionals don't even consider that a fever. Also, they can have coughing, stuffy nose, headache. And again, the concerning signs would be breathing problems. So, if the child looks like they're struggling to breathe, or their lips are turning blue, or there's wheezing or chest tightness, those are all kind of dangerous signs that you should be taking the child to the hospital. Other common signs can be stomach issues like vomiting, diarrhea, things like that. But usually for milder symptoms, even with the fever, and you're not having breathing problems, it's still best, for the child to recover at home, because most children do very well. Only for those breathing problems, you really need to worry and take them to a hospital.